Hey everybody, thank you so much for joining the live stream. We are wrapping up the month of February and that has been celebrated as American Heart Month. So organizations across the world are raising awareness of cardiovascular health and diseases. And so we wanted to take this opportunity to talk and shine the light on some of our team that are working on rehabilitation for cardiac patients. So joining me in the room for this live stream, we've got Dr. Ralph Wang. He is a rehabilitation physician at Mary Free Bed. Thank you for joining us.
Thank you.
And then we got Chris Boer. He's a physical therapist for inpatient rehabilitation. Chris, thanks for joining us.
Yep, glad to be here.
So Dr. Wang, tell me a little bit more about yourself, how long you've worked at Mary Free Bed, and the different types of patients that you work with.
Sure. I've been at Mary Free Bed for about 6 years. And primarily as far as patient care, I focus on our hospital-based patients, so who are inpatient, sleeping there overnight. And a lot of those are what we call our medically complex patients. So they can have severe lung issues, liver issues, and also, of course, our cardiac or heart patients. So that's what I focus on from a patient care standpoint.
Okay. Chris, what about yourself? How long have you been here at Mary Free Bed, and who are the typical type of patients that you work with?
Sure. I've been with Mary Free Bed for almost 13 years. I've worked both inpatient as well as home and community. And primarily, I work on what's called our medically complex team. We take care of patients that have general debility with Parkinson's, our oncology patients, and then we take care of our cardiopulmonary patients. I work in our intensive medical rehab unit, which is our specialty area for patients that need additional nursing services and oversight along with our respiratory therapy team as well. Thank you.
And so you guys probably work together quite a bit then, huh?
We do quite regularly, yes.
Yep.
Nice.
Luckily for me.
So Dr. Wang, what exactly is, cardiac rehabilitation at Mary Free Bed? There's so many ways to kind of talk about this, but what does that look like for our patients that we are working with here at Mary Free Bed?
Sure. So cardiac rehab, there's some that are more like outpatient or office-based and inpatient. Ours is more inpatient, which is hospital-based. And those are usually heart patients who are just released from the regular hospital like Cornell, University of Michigan. Maybe they had a heart attack, maybe they had heart surgery, but they're too weak to go home, and that's where we take over. They come to our hospital for about 2 or 3 weeks, and then we get them stronger, optimize them medically, so then they can go home safely with the home exercise program.
Yeah. Any other types of conditions or procedures that would bring them to Mary Free Bed to work with us on?
Yeah, I would say most heart patients, like heart attack or heart bypass surgery is very common, but we also do a lot of heart transplant and also ventricular assist device. So that's sort of like a mechanical externalized heart, like a ventilator, but for the heart. So we work a lot with those patients. And then congestive heart failure is also very common. Sometimes it's a lot more scary than it sounds, but that just means your heart is not beating optimally. It's not pushing hard enough to get the blood flowing in your whole body. And so that's a very common condition we work with in inpatient rehab.
Wow. And so, those all do sound like scary things, but that's what's so great about our team is we can handle those scary cases, those conditions, and get people better, get them to their new normal and get them back home. Chris, can you kind of walk me through a little bit about what a typical rehab program is for a patient that you're working with and Dr. Wang are working with at our team?
Sure. As Dr. Wang alluded to, we do see a variety of patients. So a patient who comes in with congestive heart failure, they're going to have some significant shortness of breath. They're going to have some generalized weakness. We're going to work with them on improving their activity tolerance, their walking, their mobility throughout the house, both through a physical therapy, occupational therapy services, and maybe even speech therapy to work on some breath support as well. Then we can have a patient that's had been on a bypass or had a transplant that's going to be quite a bit more debilitated. They're going to need additional education on how to utilize good body mechanics. If they've had a sternotomy, then obviously they're not going to be able to use their arms as much. They're going to have to relearn a lot of activities. Those patients aren't able to push up as easily. We need to get a lot of strength with those patients. And then all of our patients, we are providing them exercises and education throughout their stay, as well as educating their family
Yeah.
in order to make sure that the family is aware how much support they're going to need. It's really interesting in that some of our patients that go in for just a routine procedure can have a series of complications that can lead to a lot of additional debility, and sometimes those patients end up having an extended stay in an acute care hospital, and they may need to go to a long-term acute care hospital in case they have end up with respiratory failure, and then they can come to us in a very, very deconditioned state, which makes it very difficult for them to return home without extra help.
So, I mean, that's a variety of like conditions in how long they probably have to stay with us then too. What's like the average, or how long can a cardiac rehab patient be inpatient with us?
Again, as Dr. Wang said, it could be 2 to 3 weeks. It could be if they've had a simple heart attack and we're doing some education, it could be a week to 10 days. And then depending upon extenuating circumstances, could be more than a month. Again, especially some of these patients that we see now that come in on a ventilator or have recently been weaned off a ventilator, that have a trach, they're going to need a lot more additional respiratory support, and those type of patients are going to require an extended stay.
Yeah, and we've really been working, I feel, with more and more acute patients, people who are more and more debilitated. So it's just work taking longer sometimes to get people to go home. Is that correct?
That's correct. I mean, when I started inpatient at Mary Free Bed about 10 years ago, we didn't have the intensive medical rehab unit. That's a whole new program that's been developed over the last few years with bringing Dr. Wang on board and the respiratory team to really have that great collaboration. We needed to add a number of nurses that had a higher level of skill in order to take care of patients that are much more critically ill. I mean, patients that are coming out of the intensive care unit as opposed to just general medical floors.
So, Dr. Wang, from your perspective as a rehabilitation physician or physiatrist, what kind of advances have you seen in cardiac rehab, or just in general with rehabilitation, that has been impactful for the patients that you've been working with and their outcomes?
Yeah, I think, a lot of the science is kind of focused on the front end, like before they get here. So those are primarily focused on medications for heart rate and rhythm control and blood thinners. And also a lot of the just more advanced surgeries. I talked about like the ventricular assist device, the externalized heart, and then heart transplant too. There's always a lot of research.
So, Chris, from a physical therapy perspective, how do you customize your rehab therapies and rehab exercises for patients who've got different conditions and different fitness levels?
Sure. So we do a pretty thorough assessment of all of our patients from a PT, OT, and speech perspective upon arrival. We utilize some standardized tests. One of them is called the 6-minute walk test, and we use that to judge the patient's endurance. We also use a test called the Berg Balance test, which gives us an idea as far as how stable that patient is. And I know that occupational therapy will do tests that look at fine motor and coordination. So based on the patient's activity tolerance, as well as based on how they're doing from our initial evaluation on their transfers and their bed mobility, we're able to determine what are the areas where they have the most deficits, and then focus primarily on those areas, working to improve their lower extremity strength, working to improve their balance. We're looking at improving their endurance to enable them to get around in the house. And then everybody's home environment is different. So a patient that may be returning to an assisted living would have different expectations for their activity versus someone who lives in a third floor walk-up or has to get up and down the stairs in order to get to their bedroom and to the living room. So we take all those factors into consideration, develop a program, and then target kind of those areas that we can work on. And then also based on the patient's cognitive abilities, based on the family support, we'll incorporate the family into that education, have the patient work on exercises in the evening, having them potentially walk with family members if that's safe to do, or nursing staff in the evenings and in the afternoons to continue to build their activity tolerance, because as therapists, we're only working with patients for about 3 hours per day,
Mm-hmm.
and that leaves a lot of additional time for the patients to continue to work on their improvement.
And so this is just from the physical therapy side, but there's occupational therapy, speech language pathology. It really is a multidisciplinary team. Dr. Wang, can you kind of talk about that, like how this multidisciplinary approach can benefit patients as they're trying to recover?
Absolutely. I think one thing I'm just now remembering about our cardiac patients, since the heart pumps blood, which is it pumps it for the brain, and so when your heart struggles, actually, then you can sometimes have a small stroke or something that affects the brain, and so that's where our speech therapists get really involved with cognition and memory. And then, as Chris alluded to, occupational therapy and what we call activities of daily living, like bathing, putting on your socks, other things too. So I would say nutrition is a huge part for cardiac rehab, because you have to control your salt intake and water intake. Otherwise, you retain too much water for our heart patients. And even psychology, I think a cardiac event is life-threatening. It can be very scary, and people's lives, their perspective change and get depressed. And so psychologists and even, our pastors and they get involved also, social workers. So it is, I think when people think of rehab, they're thinking walking, but there's actually many facets. So
Yeah, that's great. Good to highlight all the different disciplines that help contribute to an overall patient's recovery. Chris, do you have any success stories of recent patients that you've worked with that have been really transformed in their recovery through our cardiac rehab?
Sure. One patient recently that discharged was a patient that went into the hospital for a very straightforward valve surgery, thinking it would be 1 or 2 days in the hospital, and ended up having some complications. Ended up needing to go on a ventilator with a trach. Had to instead of leaving right from the acute care hospital, returning home, they ended up having to go to a long-term acute care hospital to be weaned off the ventilator. They came here in a very significantly impaired state with deconditioning, having been in the hospital for several months, hadn't even been home through November here, and now it's February, and so you can imagine patients that are not moving around nearly as much, in the hospital. The priority really is focusing on keeping them alive. When they get here, patients are just excited to be able to take a shower. They're excited to be able to start taking care of some of their own self-care needs, getting on and off the toilet, and just being able to get in and out of a chair without physical assistance. And what's really exciting is when you get to see patients who come here with pretty significant oxygen needs, and as this patient did, then to be able to wean them down, to be able to do activities on room air. And then in speech therapy, when we utilize a speaking valve, which is called a Passy-Muir valve over the trach, for those patients to be able to hear themselves speaking and to be able to speak to their loved ones for the first time in months it's heartwarming. And to be able to have, something that we do as a team is we will collaborate, and then the goals of the speech therapist of, that articulation, we in PT are going to make sure that as we're doing exercises with the patients, we tell them, let's count out loud, and making sure that, that in PT we're having them assist with getting their socks and shoes on as OT. We kind of reinforce the education that all the disciplines do. So again, seeing that patient leave after being in the hospital for almost 4 months, it was just so heartwarming. And the husband was so happy to see his wife be able to be home again. And so it's just that's what really moves us and makes us is very rewarding.
And from all your time here, you probably see a lot of those stories, and that's one of those things that fill your bucket, that
Definitely
keeps you going and do the hard work. We're talking a little bit about this, Dr. Wang, but how important is family members in rehab in general, but also in cardiac rehab? How important is a family member's role in their recovery?
Yeah, I would say crucial. And I think if I had to quantify it, which is hard to quantify, there have been studies, but it's probably like 30% of the outcome. I think I mentioned sometimes if their brain is affected, they're not going to remember everything that we taught them, and their sodium intake and their external precautions if they had their chest wall surgery. And I think also the emotional component from families is critical, whether that be spouses or children. And I think the big one is once they leave here, or we say graduate, we hand them off to the family.
Yeah.
And almost all of them are not independent. That's because they came to us, in a wheelchair. And so that family member is going to help with walking for sure, for cooking, with bathing. And so if the family member is not there or we're not able to train them well, they can be back in the emergency room in 2 or 3 days. So so those family members are crucial. That's something even before they come, we educate and screen for.
So we've also talked a little bit about it too, but that psychology, the emotional support, like how does that change or become part of their recovery is addressing any issues or concerns they might have with that? Because we're talking, a recovery is so much more than just the physical side.
Yeah. So again, they went through a life-threatening event. So I think kind of dealing with that reality and the gravity of that situation, and so depression, I think anxiety, like, oh my gosh, this is going to happen again, am I going to fall? And then again, I mentioned too, if the brain's affected, the brain chemistry is infected, and that actually can cause a depression, especially when serotonin, that's the major neurotransmitter for mood, if that's low. And so psychology is helpful for that. So there's this organic component, emotional component, the spiritual component, all of these things, so I think with the psychology and social workers and our like chaplains are all involved with that.
Yeah. It is. I mean, being multidisciplinary is just so important. And this is another example of that with cardiac rehab. As we're starting to wrap up, and you're wrapping up with your work with them, Chris, as they're getting ready to head home, are there any kind of typical like at-home exercises that you usually recommend to people who are recovering and have went through cardiac rehabilitation?
Sure. So again, those are going to be individualized based on the patient's need, but typically we're going to work on continuing to maintain their lower extremity strength. We're going to work on their balance because typically they're needing to use an assistive device or like a walker or a cane when they leave here. So we want to improve that. Certainly continuing to improve their endurance. So we'll give them some standing or some seated exercises. We're going to want to make sure that they're aware of if they're starting to have complications or if they're having increased swelling or those sort of things. From a physical therapy standpoint, we're going to continue to educate them in pacing strategies from an occupational therapy standpoint with their activities of daily living, and then they'll also have some potential upper body exercises from occupational therapy and some breathing and speech exercises or cognition exercises from speech therapy as well. So we send them home with a pretty complete packet of exercises. Some of them are pretty simple but important, and then some of them are a little bit more targeted. We also will try to make sure that the family as well is in and has seen and understand those exercises, as well as understanding what are the limits on the patients. Many of them do have continued sternal precautions or limitations, and so having a family member expecting them to go home and start carrying the all the groceries in and out from the house, that's not something that's going to be realistic. So the family has to understand what is to be expected in the future, and so they all have to be involved. We'll even practice getting in and out of their vehicles and having the family come in and spend a day doing training with us in therapy. And that all works to have better outcomes if everybody is on board and understands the expectations.
Yeah. Well, Chris and Dr. Wang, it's been so great chatting with you guys. We've been on the live stream talking about cardiac rehabilitation at Mary Free Bed, all part of February's American Heart Awareness Month. It's just been a great conversation. I learned a lot here chatting with you guys. If you or a family member or friend are interested in more information about rehabilitation at Mary Free Bed or cardiac rehabilitation, you can learn about all of our programs if you go to maryfreebed.com. I can learn all the information there. So thank you so much for watching, and stay well.